It's something that sends hundreds of thousands of Americans to the emergency room every year. And for many people, it starts with what seems like a simple stomachache. We're talking about diverticulitis. Joining us now is Dr. Kowak with Franciscan Health. Dr. Kowak specializes in colon and rectal surgery. He's here to help us better understand what this is and who's at risk. Thank you so much for being here.
Of course. Yeah, thank you for having me.
First off, let's start off with explaining what exactly diverticulitis is.
Yes. So, before I kind of explain what diverticulitis is, I like to take a step back and explain what diverticulosis is. So think about the colon as a flexible tube, and in some areas it can develop these weak spots that develop pouches or pockets. Those pockets are called diverticulosis. When those pockets get inflamed or in some cases infected, that's what's called diverticulitis. So it's inflammation of those pockets.
Okay, and how do we get that? How does that happen?
So I tend to tell people a lot of times it's related to increased pressure inside that flexible tube. That pressure leads to these pockets being formed. And then why the actual diverticulitis happens is an assortment of reasons. There's not really one particular reasons, but there's a multitude of risk factors.
And what are some of those risk factors?
So a lot of times it's low fiber diet, not a lot of fiber in your diet. Smoking plays a role, obesity plays a role, lack of exercise plays a role as well. But the catch-all for a lot of this is also genetics. About 50% of diverticulitis is related to genetics.
Let's talk about symptoms. How do you know when you have this?
Sure. So you can develop diverticulosis or diverticulitis in any part of the colon, but the most common area is the left side. And so a lot of times patients will present with this left-sided lower abdominal pain that persists in correlation with potentially a loss of appetite, maybe sometimes fevers, but it's usually the abdominal pain that tends to bring people either to the office or to the hospital.
And so let's say I've been diagnosed with diverticulitis. What does treatment look like?
Sure. So it varies. The first thing that we do is we say, okay, is this a complicated form of diverticulitis or uncomplicated? So a majority of people, when it's uncomplicated, the treatment is bowel rest. So I tend to tell people stick to a liquid diet for about a day or two and then start to transition to a low fiber diet before then going to a high fiber diet. When it's complicated, that typically means you have either an abscess or a pocket of pus or a perforation, which means a hole in the colon. And then those patients, they will need to be in the hospital for IV or intravenous antibiotics.
When does abdominal pain become an emergency? How do you know when it's time to go to the emergency room versus take a Tums and see if you feel
absolutely. Better? So I tend to tell people you have to look at the trend of what your pain's doing. So is your pain getting worse? Or is it starting to get better? Or is it just gradually every single day getting worse and worse and worse to the point that you're now having the worst pain you've ever experienced? That trend and that magnitude of pain is typically what I look for, and then tell the patients, obviously, you need to go to the ER now.
Thank you so much for
helping us
better understand diverticulitis and maybe most importantly when it's time to get checked out. We've posted additional information plus our entire interview, so you can check that out at WTHR.com/realmenweargowns.
Great info, Dustin and Doctor. We appreciate